just tell me when.
Got a bit of level if we could, just your name for level.
Yep, Michael Kalimnios, CEO, Aubry, Vadonga Health.
Yep.
All good to go?
Good, Michael. Yeah.
Good day. Thanks everyone for coming this morning. We've just got a bit of an update, of course, about the COVID situation across our catchment, Aubry, Wodonga and broader. You'll be hearing from Tracey Oakman from Murrumbidgee Local Health District about numbers in north of the border, in Aubry, Greater Hume and Federation areas, and then Lucy Shanahan, our Director of Public Health and Aubry Wodonga Health, around the 5 LGA that we cover, which obviously includes Vadonga, about the numbers and situation there. Just broadly, I thought it might be useful just to reinforce to everybody just the process that exists in our region in terms of how we manage COVID. South of the river, Aubry Wodonga Public Health Unit, of course, manages all the contact tracing and exposure sites for everyone in the Victorian catchment. North of the river, Murrumbidgee Local Health District again manages all the contact tracing and exposure site issues with people in New South Wales that are impacted in our area. Aubry Wodonga Health, however, does provide the care for any COVID positive patients that's identified, irrespective of whether they're in New South Wales or Victoria. So it's just important to understand that. Obviously, Aubry Wodonga Health works very closely with Murrumbidgee on a daily basis just to make sure we are connected and understanding what's actually happening from a public health point of view in New South Wales, so then we can bring appropriate patients under our care. Also, just a couple of other issues to note. Aubry Wodonga Health has stood up an incident management team and we are now in an emergency response mode within Aubry Wodonga Health. What does that mean? We are now looking at what staff we need to bring to bear to make sure that we're adequately responding to the outbreaks that we have in our region. This means that some of our non-critical areas or non-essential services will be reduced over the next week or two, so we can redeploy those staff into areas where we need to focus on. Key in that, of course, is testing, where I know there's a lot of issues on both sides of the border about people accessing testing clinics. We are really hoping from an Aubry Wodonga Health point of view that we'll be able to stand up an extra clinic and extend hours from tomorrow. We're just simply sourcing staff, as I say, from AWH redeployed staff to be able to do that. Also, I should just mention that there are some issues with furloughing of staff at Aubry Wodonga Health at the moment as a result of the COVID outbreak. We've had a bit of an issue overnight in our paediatrics ward where there was someone who was in the ward who was positive COVID, a staff member. That has resulted in us having to furlough a number of staff. So we've got reduced capacity at the moment in our paediatrics ward. We're obviously conducting contact tracing as we normally would do when these things happen in our hospital environment, and we're looking at what staff we can bring back on, and indeed we can redeploy staff from other areas to make sure that the paediatric service continues. At this stage there's no concern about that, and we just need to work through the process. And I would emphasise that we have already had a number of issues where positive patients have been presenting to various clinical areas within Aubry Wodonga Health, and we've managed those effectively, so this is a new process for us. With that, I might hand over to Tracey Oakman from Murrumbidgee to give you a bit of an update of the situation in our New South Wales catchment. Thank you.
Thanks, Michael. Thank you. So overnight, Murrumbidgee recorded 10 positive COVID cases. 8 of those were located in the Aubry LGA or the Hume Shire LGA, and that brings our total for the last since early September, Aubry and Gindra cases to about 49. So we have had a significant, obviously significant outbreak in the region. A lot of those are younger people. We have a peak in the 15 to 21-year-olds in terms of case numbers, and then either side of that age group we also have quite a few cases. So the young people are socialising together, and I would just encourage them to, if you've been with a case or you're a close contact or you're a casual contact, please make sure you get tested. It's really important that we get tested, even if you don't think you've got any symptoms. Please get tested. We do have a number of exposure sites come out of that, and what we are doing is putting those exposure sites onto the New South Wales Health venues of concern, and I encourage you all to please have a look at those. There's too many to mention just here and now. We are working with the venues, any venues that may have been a higher risk exposure site, There are some GP practices and some aged care that we're working closely with to identify those at risk and to communicate with them. So with those sort of places, we actually have good records of who was there. So we're able to come in contact with those people and give them appropriate advice. Our testing clinics in Aubry today, there's an additional pop-up testing clinic at the Lavington Sports Club car park. That's open from midday today, so people can go and get tested there. And we'll be open moving forward from 8 a.m. to 5 p.m. From today after today. So that's another site. Our pop-up testing clinic will also be in Gindra today. So if people are out there and need testing, you can go there. For businesses where if a business becomes aware that they are an exposure site, the public health units are not able to call all businesses now that may be a casual exposure site because of the number of those, or not getting to them before they're actually on the webpage, and some businesses are finding out that way. Other ways businesses are informed by the cases themselves. There is what businesses should do on the New South Wales webpage, and there's some advice provided to businesses of what they need to do. And also, if a business has a staff member that is a positive COVID case, that they should call Safe Work, and there's processes in place then for business support. So for any businesses who are not sure what to do, jump on the website to start, and you can contact Safe Work for support. I think that's it. Lucy.
Thanks, Tracey. The Aubry Wodonga Local Public Health Unit can confirm an additional 23 cases in our Northeast Victorian catchment region today. That consists of 14 cases in the Wodonga LGA, 6 cases in the Wangaratta LGA, and 3 cases in the Towong LGA. All cases have been contacted and are at home isolating, and we've supported testing for each of those cases. We can also confirm that from these cases there are no additional public exposure sites of concern for the community, and that's why we haven't seen any changes to the sites that are listed on the Victorian Department of Health website. The majority of the cases that we're currently working with have certainly been isolating at home because they are linked to known cases, and so we're seeing that chain of transmission predominantly through household contacts. We do have some new cases that have popped up, we think through travel to Melbourne and coming back to the region, and we're continuing to work with those cases and understand any sites of concern or community impact out of those cases. Like Tracey, we've seen a really strong testing response to testing sites in Wodonga today, and we know that those sites are at capacity. And as we've indicated, we are endeavouring to stand up an additional testing site tomorrow, or as soon as we possibly can. We really are thankful for everyone coming forward for testing in the last couple of days. Our key ask is that people come forward for testing if they have been contacted by the Department of Health, either New South Wales or Victorian Departments of Health, if you are at all symptomatic, or if you have been to a listed exposure site on either the Victorian or the New South Wales Department websites. I think one of the other good resources to point people to at the moment is that there is a COVID self-assessment tool on the Victorian Department of Health website, which is a really easy question and answer web form that people can work through, and it will give you the best advice possible as to whether you do need to come forward for testing at this time or not. And also, if you have been contacted, it gives you advice, or if you're aware that you've been to a business that is subsequently closed for cleaning or advised you that they may be an exposure site, it gives you good advice as to whether you need to test and isolate until you get a negative result, or test and isolate for 14 days. So we encourage people to jump onto the coronavirus website through the Department of Health in Victoria and have a look for the self-assessment questionnaire. In relation to vaccination, I'd just like to mention that we do have walk-in appointments at our Wodonga vaccination hub in High Street, particularly for Moderna. So we do have access to Moderna, Pfizer and AstraZeneca at our Wodonga hub, and we do have walk-in appointments available for Moderna. We've got appointments for both first and second dose, so we're seeing really good vaccination rates across the region, but we really do encourage people, if you've had your first dose, to come forward for your second dose, noting that there are lots of options available either at the state-run hubs or through GPs or local pharmacies. with that, I'm going to hand over to Evan.
Thanks, Lucy. And Kev Colton, Mayor of Wodonga. You'll hear from the Mayor of Aubry, Kevin Mack, shortly. And he'll probably have a very similar theme, I'd imagine, to myself. Obviously, we're now entering after over 18 months of challenging times of being locked down, particularly in Wodonga's case, being locked down several times for no real apparent reason. We know as a community are running out of fuel in the tank. But I guess the urgency now is for us all to lift, to do everything that we've already at times shown we've done well and felt like we've done it for no real reason. Now is the time. Don't be confused at all. Now is the time that you need to follow all that health advice. In terms of vaccination rates, I know that'll be a topic for some people in terms of comparing Aubry and Wodonga. The fact of the matter is we're doing okay. We've come a long way. And in terms of people getting towards that second dose, we know there's people within the community that may have had their first dose and for whatever reason aren't able to come forward yet. So just I guess the main message is be mindful of the entire community around you, because this will be testing. It will be very stressful. We've watched other large regional centres go through this, but obviously once again we've got the added complexity of the fact that we are a border community and you do have multiple interests in terms of health services. So we've heard the frustration. Those that are here that have spoken before myself have obviously highlighted some of those challenges and what's still to come. But please be patient. We know it's going to take a while to get through some of the testing backlog, and just be mindful of your fellow citizens around you within the community. But just keep following that advice that you've been doing so well, but really pay attention to it now, because now is the time for you to have your part to play. Thanks.
Okay, hi everyone. Look, we're just here at a very solemn day for Aubry. We've one fatality due to COVID, which is very sad. Our hearts go out to the victim and the families and friends associated with that. It's probably a timely reminder that we are exposed to this pandemic currently, and it is spiking. So we encourage our community, whilst the state is not in lockdown, they need to think about their movements and what they do next. And I know we don't have to wear masks, but sometimes I think in this current condition we need to self-impose our own disciplines. Whilst the group mostly affected are under 30, again they're vulnerable, and anyone that hasn't been vaccinated needs to be vaccinated. The numbers are encouraging, as indicated, 73% second vaccination. I think again we're doing everything we can do, and I do agree people are quite jaded, but we need to step up and continue to do what we're doing to support each other and keep each other safe. So I see that the site is being opened at Lavington at midday today. It'll be open between 8 and 5 as of tomorrow. So people will be able to get tested, and I don't think it's helpful that people cast stones towards and criticise in very trying circumstances. So I think again, we need to be patient.
Just on the testing, you said we should be patient, but is it fair to encourage people to get tested and then turn them away when they do front up?
Well, we only have finite resources, and I think again, Wodonga Health and Murrumbidgee Local Health District are doing as much as they can in very trying circumstances with the resources they have, and I think it's an indication of what is currently in existence. I think I don't really see the point of criticising. I don't see the point of, it's not going to change it. We now have put other things in place. There's extra testing sites across Aubry, Wodonga, which will give people access to those sites. We've got a number of schools closed in both cities, which again is a reminder to parents and everyone that this is serious. And I think again, people, if you look at what's happening in the CBD and across our city, people are getting the message and starting to limit their movements. But I just don't think it's productive making bold statements from Canberra about what's happening in Aubry when the people on the ground are doing what they need to do to get it done. I just don't think it helps. People are under a lot of pressure. They're feeling a lot of stress. Not helpful.
What has the health bodies said to you as council they could have help with, and how you're advocating the government for more resources and support?
Well, as best as I understand, Murrumbidgee Local Health District have asked the New South Wales Health Department for more resources. There was a meeting between Wodonga Health and Murrumbidgee Local Health District yesterday. As I understand, Michael would have indicated that they're pooling their resources and working together on this one. Because we have this disparity of Vic Health and New South Wales Health, it was always going to be testing. But as I stress, the people here are doing as much as they can. They're onboarding as many resources as they can, and they're working closely together. So there's no real room for panic. It's just they'll get the job done, just be patient and get tested and get vaccinated. I think really that is the message we've got. We can't just magically make people appear out of nowhere. So the best solution is stay home if you don't have to go out and do the right thing. I mean, it's a virtual lockdown in some ways, but it's the only way to provide a solution to this problem. And right now, we're doing what we can to get that message out.
Have you heard any news about what that threshold is for potentially lockdown in Aubry or Wodonga, or is lockdown completely off the cards?
Look, I don't believe anything's on the cards at the moment, because the state government stated that lockdown is not an option. But that's not to say vulnerable populations are impacted severely by this current outbreak, that they won't consider it, is my understanding. So right now, we'll manage it as best we can, and I believe they've got it professionally managed and doing their best work as we speak. So let's just be patient, let's just be respectful of the people doing their work, and as I said, let's be productive about what's going on and get it done. And it was always going to be here, it's arrived, let's get through it.
A question for both mayors. How concerned are you about the number of schools that have had to close, especially with HSC exams coming up?
Oh look, my understanding is the health department and the education department are at loggerheads about what they do and what they don't do. Health have their own protocols, education have their own protocols. Education has taken that step, that's their call, both from a Catholic education perspective and a state perspective. Doesn't help in terms of people en masse going to get tested when they're not close contacts, but at the end of the day, they made that choice, and it's unfortunate, and hopefully the exams won't be delayed, and hopefully we'll be getting back on track by the end of this week. But right now, we just encourage people to get tested, get vaccinated, and as I say, limit their movements and do what they can to help us to help themselves. So really, been saying that from day one, people need to police their own behaviour and police their movements, and this is happening. That's the point I'll make. This is happening. This is not something that we're just going to walk out of tomorrow. Let health take its course. People need to do what they need to do to help us, and that is stay home if they don't have to go out. Don't socialise as they ordinarily would do. Under the current public health order, they can have, I think, 20 in the home. Really? We're in a pandemic right now. We've got major numbers for in context of the percentage of our population. Be smart about it. That's all I ask. Just be smart about it and think about someone else's loved one that could get this COVID, as has happened already, and could die. So let's be really upfront and honest about that. Let's get it done.
Are you encouraged?
Sorry, Helen. I'm aware that Tracey has a meeting at 11:30.
Okay.
So potentially you might want to hand back to her so that we
Yeah.
can fire some questions before
Thank
she needs
you.
to run off.
Thank you.
They're looking at me. I didn't know who you were asking for, sorry.
Tracey, can you just give us an overview of the COVID death and any more details that you could provide on that one?
Look, out of respect for the family, no, I won't. It was an elderly person who unfortunately has passed away. So that's all I'm prepared to talk about. So.
Tracey, can you tell us a little bit about your investigation as to how COVID got into Mercy Health? Has that revealed anything as yet?
Look, at the moment, investigations are still ongoing. We don't have an answer for that question yet. It will take some time. Quite often, we'll have to test contacts and so forth to determine if one of those was positive and therefore may have been the source of the original infection. So we've got a fair way to go before we can be confident, even if we ever find out, and sometimes you never do find out. But we do have a fair bit of investigation still. It's very early days.
And is there anything else you can tell us about the schools that have been closed and the number of students who have COVID?
Yeah, look, not specifically. The Department of Education and the Ministry of Health handle the school out cases and follow-up. Individually, the public health unit in New South Wales don't do that. So I don't have exact details from those schools, I'm afraid, sorry.
Have you had any further positive cases at Mercy?
There are further cases that have come overnight that won't be in today's data. But we have not got all results back yet, and further testing is going, so we can expect more cases, yes.
How many came back last night?
There were at least 4. There's been at least a total of 4 at this point, but I expect more. Yeah.
And are they residents or including staff as well there?
At the moment, we have tested all the residents, and we're meeting today to arrange a testing regime for all the staff. So.
Is it the only aged care facility that is affected at this stage, Tracey? Mercy?
At the moment, that is the sole one that we have in this region, yes.
Are there any other sort of high risk settings that you have cases in? Would GPs be considered one of them? You mentioned that earlier.
Yes, I said earlier. So there are a couple of medical practices that we are supporting that have had a case attend those. And we're just working through with those. We don't generally put those in media because we're able to identify through appointments and staffing lists of people that are there and directly contact those people.
So you don't expect any of those GPs to pop up on the New South Wales Health website?
No, not at all.
Just on vaccination, Albury has reached the target of 70%. Is that one of the reasons why you guys aren't saying this is a uncontrollable outbreak? Is that the reason why we've kind of dodged a bullet?
Look, not at all specifically. We're just going through our processes. What we've done is standard processes for any outbreak is to isolate any risks that we see, to test and to go through the processes that we're going through. This is no different to other outbreaks that we have handled across the district and also for Southern New South Wales, which I manage as well. It's a process of you needing to identify the cases in the community that are positive that we haven't worked out that are there yet, and that's why the massive testing is really important. And when we can pick up those cases that are unknown in the community, that's when we can see our increase in cases start to drop. And it will take a little while for that to happen. We can expect a process of there'll be a number of people who don't know they're infectious at this point, and then we find those and we make sure that they're isolated and their contacts are isolated as well.
And people understand it takes some time for that New South Wales Health page to be updated. Should businesses be self-identifying at the earliest opportunity though, because there have been some that have chosen not to, that have now popped up on that page?
So the venues, there's actually a progression to a new system in New South Wales Health now with the venues, and they will be updated at 3 o'clock and 8 o'clock every day based on case interviews that are done. So they're probably much more timely than they have been in the past in terms of getting them up there. You will find that businesses have been called by cases. Some of them are staff themselves or in fact they visited the site and they're doing the right thing and letting the business know. So again, those businesses should jump onto the New South Wales webpage and look for what businesses should do, and it has some great information there. And then of course if it's a staff member, they should contact Safe Work.
What's the largest household of COVID positive patients that you're monitoring at the moment? Have we got sort of whole families of 4 and 5 positive?
Oh, look, I can't really, I don't wish to risk identification of any family, so I'm not going to talk about specific families.
Just on the testing yesterday, there were criticisms that you didn't have enough testing available. What do you say to critics of your regime?
Yeah, look, I think we're all human. To set up a testing clinic when you need to get people called in from days off work or transferred from other jobs, and so that takes time. If you think about if you're at home and on a day off and your boss rings you and says, I want you to run a testing clinic, it might take you might not be available. You might take you half a day to get there, and so the process around that, and it's not just one person, it's a heap of people as well as the clinic. So we are set up for surging, but it does take a good 12, 24 hours to be able to increase a testing clinic. And so we've arranged for Lavington to do the testing clinic this afternoon at Lavington Sports car park. And so it does. We just don't know in advance that a high school may decide that the children all need testing, or the it is a time process. And I will say to anyone who wasn't able to get tested yesterday because the lines were too long or they were unable to get in, go home and isolate and come back tomorrow or come back today. With those extra clinics that we've been setting up over the next, over today particularly, it's not too late to get tested, and if you stay isolated just for that one extra day while you get tested, that's all we can do. Everyone's human. Those nurses working in the testing clinic are working very long hours, and they're very tired by the end of the day, and to have someone, not happy with them at the end of the day, it's really demoralising for those hard-working nurses too. So please, I know everyone's worried. Everyone who goes for a test is really concerned, and also we recognise it has implications for your work if you need to isolate while you're waiting for that result, but that's the way of it. We just have to accept that that's what we have to do these days.
Are you in talks at all with the government to bring more resources to the border, given we are experiencing this surge at the moment?
Yeah, so there's different elements of that. So I'm involved in the outbreak management team that is looking after the aged care facility, and part of that process is protocols for getting resources to come and support them from outside the area. So that's certainly one that I am involved in. And we always are negotiating. The ministry has set up contracts for laboratory testing, and so that's what we initiated yesterday. So there's lots of preparation. It's just about enacting some of that preparation now to get those things happening.
I just had a question for a colleague on Thunderstorm Asthma, completely unrelated, but if you're happy to answer
Yes,
that.
I am.
Is it something particularly we have to worry about this spring?
Yeah, so Thunderstorm Asthma season started on Monday. For the next 4 weeks, we just ask everyone who has asthma in particular, make sure you take your puffer with you everywhere you go. If a thunderstorm happens, make sure you stay indoors. And if you're parents of kids who have got a bit of asthma or even hay fever, stay indoors when the thunderstorm happens. It's an odd phenomenon. A lot of people who are not local don't know about it. But the pollen gets picked up by a thunderstorm and fractioned into small parts and then pushed down into the ground in airflows, and people breathe in those small particles, and because they're broken up it can get deeper into the lungs, and if you're susceptible to asthma it can trigger an asthma attack. So please be really careful. If you haven't been to the doctor for your asthma management plan, for your annual plan, make sure you do that really quickly, but make sure you've got your asthma medication with you at all times.
Just a question with testing clinics. A location went out this morning about the Aubry sports ground instead of the Lavington sports ground. Communication wasn't quite correct there. What's your view on that?
Look, the people who do the media are also human, and if they've got the wrong venue, that they're human, they'll correct it, and that's what we'll do. There possibly is the showground still is.
No, the Aubry football ground, so the Aubry Tigers ground was listed today.
Oh, was it? Okay. So look, it's people are human. We make mistakes. We correct them if we get them wrong. If someone's realised we've done a wrong thing, let us know and we can correct it. We try to get the best information out at all times, but we're not machines. Just remember, people are human, and everyone's trying really, really hard to protect the community the best we can.
Just quickly on the cases today, are they all, do you know the links of them? Are they all linked, or are there a number still unlinked?
Look, within a day of a notification, there's much investigation to be done still. And even when we link a person to another person, it actually doesn't rule out they haven't got it somewhere else as well. It reduces the likelihood of that, of course. But so we just need to do further investigation on all those cases. Some of them are household, so obvious links. But others need further investigation.
Still looking for that initial source?
We were still trying to confirm that, yeah. And look, it's really hard. It is likely there's been multiple sources from this Aubry outbreak, and it's very difficult whether we'll ever really know.
Thank you, Tracey. I know you're
All
going
right.
to get
Thanks,
going.
everyone. Thank you.
Lucy, are you right to go next, or do Michael next, or?
I actually have another meeting.
Yeah, thanks, Tracey.
Give me 1 second. Can you hold your phone up a little bit? Because now it's just the screen's flashing the sunshine.
Oh, sorry, I'll stop.
You're right.
Yeah.
That will be great. Thank you. That's good.
Sorry.
You're right.
Yeah, do you mind just giving us a bit of a rundown of cases and?
Yep, I can give you that, as much in terms of LGAs. So As mentioned previously, we are reporting 23 new cases today, 14 within the Wodonga LGA, 6 in the Wangaratta LGA and 3 in the Towong LGA. That brings the total number of cases that the Albury-Wodonga Local Public Health Unit are managing locally to 44 currently, so 44 active cases across the 5 LGAs that we support. Within that 44, there are 13 cases within the rural city of Wangaratta, 2 in the Alpine Shire, 7 in the Towong Shire, 1 in Indigo Shire and 26 within the city of Wodonga currently.
Can you talk us through, I guess, the links or known sources of these cases?
So most of the cases that we're seeing at the moment are household contacts of known COVID cases, and this is something we've addressed a number of times, that the strike rate within households is really high with the Delta variant. So the majority of transmission that we're seeing is a COVID positive person in the house and then their household contacts, so family members or housemates becoming positive as a result of that. So that's the majority of the cases that we're seeing at the moment, is a flow-on effect from that. We do also have, as we know, there is community transmission and that, as Tracey has indicated, takes a bit more time to work through. So when we're unable to quickly and easily identify a COVID positive case within a household or a close social network, it takes a bit more time to contact trace and understand where someone may have acquired the virus. And particularly at the moment, there might be multiple sources or multiple avenues that we need to explore to understand where someone may have acquired the virus. So the contact tracing team are working through that as quickly as they can. We have increased the number of contact tracers that we have working locally within our public health unit so that we can work through each case as quickly as we possibly can.
Do we need to bring up more resources from the likes of Melbourne? We know they've been deployed to Shepparton at a time when they've had high cases. Have you been in talks with the government at all?
Yeah, we have. So we have put in a request through the Victorian Department of Health for additional resources, and we do have some additional resources coming toward the end of the week. I think the important thing to note here is we're not the only region that is experiencing this. There are outbreaks in most of the regional areas across Victoria, and testing at the moment is a huge challenge for all areas, including Melbourne, but also across Latrobe, Mildura, Shepparton, Bendigo. All areas are experiencing a surge in testing need, and as we've identified, there's only so many people to draw on to be able to complete the testing as quickly as possible.
Is it your unit that's managing schools, or is it the same process as the New South Wales side? And is it concerning that there's children who can't be vaccinated that might create a bit of a super spreading event?
So within Victoria, outbreaks in schools are managed through the Department of Education in collaboration with Department of Health, but the response is absolutely led by the respective Department of Education. We are working with our local departments of education to understand the information provided to schools. However, the majority of the schools on the Victorian side of the border, particularly those that have closed today, have closed as a precautionary matter. And to buy time to understand the impact on the school, to really identify where, if there are particular year levels or classes that are more at risk than other year levels. Rarely across a school is a whole school actually impacted when there is one COVID case in the school. And at the moment, in the schools that are closed today, we know there are of a single case in the schools, but absolutely applaud the schools' efforts in closing and minimising people's movement within the schools, but also across the community today. So it's a great precautionary measure. I know that Catholic College, for example, in Wodonga are working really quickly to reopen the school as quickly as they can. It was a 24-hour precautionary close at this time.
St Augustine's, there's reports there's 5 positive cases there. Can you confirm that?
No, I can't.
Can I just clarify, today you've said that there were 14 cases in Wodonga. The Victorian Presser this morning said there were 13, all linked to Z-Bar. Can you just clarify the correct figure there?
So the number certainly that we have locally at the moment is 14 cases. One of them may have been a case from earlier yesterday that hasn't necessarily been picked up in the corroboration between ourselves and the Department of Health.
Are we seeing such a crunch with testing because it is a lot of young people, and we only have how many actually test children? The walk-in clinic, where can people actually go?
All sites across Aubry and Wodonga test children, and so families can take their kids to any of the sites. Certainly both Aubry Wodonga health sites at Vermont Street and at Smythe Street are testing children. We are seeing quite an influx in testing because we have had schools closed, and again we understand people's absolute concern at this time and their desire to get a test to understand if their family's been impacted. But again, we do ask people to come forward, particularly if they've been requested to do so by the Department of Health. if they're at all symptomatic or if they've been to an exposure site. And this is the largest number of exposure sites. Whilst we haven't added any in recent days, it is the largest number of exposure sites that we've seen across our region at any given time, and that's quite understandably generating a really strong response from the community.
How confident are you that these numbers, I guess, are accurate? If people are being sent home from testing because the wait times are, so long and they can't fit them in, are we confident that there's, I guess, it's an accurate representation of how many positive cases there are in the community?
Well, we've got an accurate measure of how many cases we know through the tests we've been able to complete. I don't think at any time we've got a clear measure of how many COVID positive cases there may be sitting across our region. The critical thing is, though, that if people have been to a testing site, haven't been able to get tested today and have been asked to go home, is that people do precisely that. That people go home and they isolate and they try again tomorrow to get a test, and that is the best way that we can bring this outbreak under control.
Is it possible, Lucy, that too many people are getting tested? In the metropolitan media, there were messages going out this morning that partners of casual contacts were getting tested, and that was clogging up the system for those who really do need to get a test. Is there too many people getting tested?
It's a tricky one, Helen, because we want as many people to come forward for testing as possible. But at the moment, when we do have quite a surge on testing, our request is that people come forward if they've been to an exposure site, if they've been asked to do so by either the Ministry of Health in New South Wales or Department of Health in Victoria, or if they're at all symptomatic. Lots of people do come forward for testing, and to give you an example, on an average day when we're not in a surge response within our Aubry Wodonga testing sites, we test between 120 and 180 people. We did over 500 tests yesterday. So to scale up quickly and to provide that response in such a short space of time, we have put additional resources into our testing site. But we do know, and particularly with the information going through schools, that large numbers of families are coming forward, which we completely understand. We don't want to deter people from coming forward for testing, because surveillance testing, that understanding at any given time as to what's sitting across our region, is one of our best lines of defence. However, at the moment, we do ask that people come forward if they do fall into our priority categories.
Are there any ways we can, say, call on the Army to help us testing? What does at capacity mean? Is it the people? Is it the number of tests?
So at capacity means our ability to complete tests within our opening hours, and certainly we've run extended hours in the last couple of days across our testing sites. We know this morning, for example, that we were out to an 8-hour wait at our Vermont Street Clinic by 9 o'clock in the morning. We know that the majority of the testing sites across the border were at capacity by 9 o'clock this morning. And it's pleasing that there is an additional site opening at the It's pleasing there's an additional site opening at Lavington Sports Ground this afternoon. I'm sure it will quickly reach capacity as people move there to try and get a test today as well.
Why haven't we seen any businesses disclose like a tier 2 status? Is it just because these people have been all household contacts, or?
Yeah, so we haven't seen any new additional tier 1, or what we used to refer to as tier 2 sites across the Victorian side of our border, because the vast majority of people are doing the right thing. We do have, as I mentioned, a lot of household spread, so we're seeing the virus spread between household contacts. And most people, in fact the vast majority of people, are staying at home and isolating until they get a test, and then staying at home and continuing to isolate until they get their test result. As a consequence of this, we haven't seen significant impact on our local businesses, which is really pleasing to see.
Probably need Michael as well, if we've still got time. Yep. Well, do you mind just starting off with explaining what that incident management involves? Were you expecting to be doing that, at this time as we're opening up, or is it, a concerning thing?
So look, we always expected, as all of you would be aware, that the modelling indicated that as various jurisdictions started to open up, that there would be a surge of cases. So we always anticipated this. The incident management team is an internal emergency response group that we set up within Aubry Wodonga Health itself, and its main purpose is just to make sure that we are focusing on those areas that we need to in terms of COVID response as a priority. As I said before, the major issues we're really focusing on at the moment are around workforce, and that's from 2 aspects. As I said, we do need to look at now redeploying people from non-essential or non-critical service areas into areas like testing. Our biggest chance of improving our workforce isn't about getting people from Sydney or Melbourne or from the Army or wherever else. It's actually about redeploying people from within Aubry Wodonga Health into those clinics. The second issue for us in terms of the IMT and standing that up is we will have staff, and we do already have staff that are furloughed, either because they're close contacts or secondary contacts through schools and children and other contacts through that area. And as I mentioned, we have already had an exposure in our paediatrics ward. So the IMT is meant to be a group where we can flexibly respond to those issues and make sure that we're able to continue delivering services.
And what's the impact on the hospital and I guess across the board when you've got furloughed staff as well as having to redeploy them to assist with COVID testing and all those sorts of things?
Yeah, so obviously, as I say, we're looking at those areas which we would classify as non-core or non-critical. So those will be ramped down. So we'll obviously be coming out and talking to the community in the next day or two about what those areas are, just to make sure people are aware that for a period, probably for the next 3 to 4 weeks, those services will be limited. So there will be a reduction in service in those areas. If it's more sort of responsive in terms of we have an unknown or unexpected exposure in one of our clinical areas, potentially that can be quite significant, particularly if it's in a critical area. In the areas you think about emergency departments typically. We obviously have very, very stringent protocols and processes in place at both our EDs in Wodonga and Aubry to make sure we minimise that. We have had a couple of patients who have presented that have been positive, and our processes have stood up very well, so we haven't had to furlough any of our critical care staff, such as emergency department staff, so that's good. But obviously, if we do have an unexpected exposure, it can cripple services and it can be quite significant. We saw that happen in GV, Golden Valley, when the outbreak was there, where at one stage they had over 500 staff that they had to furlough, and that had significant impacts on their ability to continue to deliver services. So we're doing everything we can to avoid that, and so far our protocols and processes have stood up pretty well.
What are the specific impacts to the paediatrics ward, and where can you get more staff to fill that gap, considering they are specialists?
Yeah, so at the moment there isn't a great impact. We've just closed, I think it's 8 beds or so, while we do our contact tracing and really understand what is the risk and what staff particularly may have been exposed, and of course patients are part of that as well. We're not experiencing any great pressure on paediatric services at the moment. Once we've finished that process, then we'll assess what are the challenges and issues for us. There are many staff right across Albury Wodonga Health that have multiple skill sets. Some of those will be appropriate to be redeployed into paediatrics. So we've got a process where we've identified the skill sets right across all our workforce, both clinical and non-clinical, and looked at where we can potentially redeploy them if needed. So we'll just lean into that process if we need to ensure we continue to provide inpatient paediatric services.
Is your COVID positive clinic giving any care to very young children at the moment?
Look, I probably can't comment on that. There are families, obviously, which will include children. The age profile of them, I don't have that information, I'm afraid. Thank you.
Thank you.